So again, we're from the Center for Health at the Board of Pension and Health Benefits. I'll tell you a little bit more about that. But first of all, we're very pleased to have the coveted after lunch spot. And actually, we're more pleased because we noticed these things. The snacks were healthy at this morning's break, and I think lunch was pretty good on the nutritional scale. So thank you. So today I'll do a brief promotional announcement about the Board of Pension Health Benefits, the Center for Health, then the good stuff, quote unquote, the snapshot of clergy health status, and then we'll talk a little bit more about some of the factors that influence clergy health and those dynamics. We fully believe at the Center for Health that healthy clergy is inextricably linked to vital congregations. Healthy pastoral leaders, healthy pastoral leadership is crucial to thriving, flourishing congregations. It is out of that objective that the Center for Health focuses on multiple dimensions of health. As you can see, physical, emotional, spiritual, social, and financial. We want to be the resource across the UMC that has programs, workshops, these types of information sessions to help ingrain healthy clergy, healthy congregations. So let's talk a little bit about the health of our UMC clergy. Sad to say, if this were a state of the clergy health state, I would say the state of our clergy health is poor. This is the second year, this 2013 clergy health survey that we conducted. I'll tell you a little bit more about the specifics of the survey in a moment. But as you can see, the lowlights of the survey are the higher risks for the UMC clergy among these indicators. The next set of slides will talk a little bit more specifically about some of these results. But background briefly about the survey, a representative sample of active U.S. United Methodist clergy. Representative in terms of age, gender, marital status, jurisdiction or region, and racial ethnic minority. And I share that with you so that you understand that the results that follow are a pretty good snapshot of view into the state of our clergy's health. Let's start with some of the physical conditions results. First, about the graph. Anything in red, surprise, that's bad. What that means is that for those particular conditions, our clergy were worse off than a matched set demographically of U.S. adults. So for those of you who took copious notes about where we matched up with our current clergy in terms of age, gender, marital status, racial, ethnic, race and ethnicity, and geography, well, that's how we compared our clergy's health to the benchmark. So if it's red, we don't get a prize for being worse off than a comparably matched demographic pair of U.S. adults. So obesity, 4 out of 10 of this snapshot of active U.S. clergy are obese. The bad news is another 39% are overweight. So it's not like, you know, the bell curve. It's more like this. Now, probably not surprising just with that obesity data, some of the other related conditions. High cholesterol, a majority, 51%. So what I like to say, if two clergy are going up an elevator and they're in the elevator together, if I ain't the one who's got high cholesterol, I guess the other person I'm sharing the elevator with does. Again, not a good statistic. Cholesterol, I just mentioned, but you can see some of the related statistics, borderline hypertension, asthma, pre-diabetes. This is just the physical side. So maybe you're saying, oh, that's the physical dimension. As I started off, the Center for Health focuses on multiple dimensions of health. So let's take a gander into emotional health. Many of you in the room are probably far more familiar with the patient health questionnaire, the 9 questions that are asked in terms of diagnosing and treating depression. Well, we had those questions on our clergy health survey. And as we can see, more than half of the clergy indicated, nearly 60%, feeling tired or having little energy. You can see the results to the other questions that make up the PHQ-9. Others of note, 4 in 10 have trouble falling asleep, staying asleep, or sleeping too much. I'm making sure none of you are sleeping right now. Although the numbers drop, look at all those that represent approximately 1/4 of the clergy. Feeling down or depressed, little interest or pleasure in doing things. Again, these results, frankly, are a little bit frightening. And in fact, they are frightening because when we analyze the responses to the PHQ-9 on our survey, we found that, 5% of our clergy suffer from depression. And again, that's red. That's nearly twice as much, that rate is nearly twice that of other demographically matched US adults. We see more than 1/4 suffer from at least one symptom of depression. So that means on those 9 questions, at least 1/4 of the clergy indicated they experienced one of those symptoms. We asked on our survey the occupational distress scale. I guess good news, bad news. Good news, we found that our clergy were not that different from other clergy. But once again, we can see some of the numbers are not that encouraging. Nearly 50% said they experienced stress based on the challenges of the organization. Again, we can go down the line, but what we see is a picture of clergy, poor health, physically, poor health, emotionally. Stress is a huge factor in the life of our active clergy. Financial stress. This morning, we heard quite a lot about how that debt load is increasing. A large portion of that debt undoubtedly is from undergraduate school, but piled on top of that can be consumer debt and, of course, graduate school debt. So we found that more than 1/3 of the clergy have at least a moderate financial stress. So regardless of what lens of health that you're looking at the state of the UMC clergy, and frankly, these results are very similar to previous studies done by Lutherans, Episcopalians, the Credo Institute, so it kind of goes part and parcel with the vocation. I'm now going to turn it over to Shelly, and she'll share some more data with you.
I'm the preacher in the group, so can you hear me okay? Good to be with you this afternoon. Anne took a look at the status of UMC clergy health from one perspective and using one instrument. What I'm going to do is show you some statistics using another instrument. The General Board of Pension and Health Benefits provides a health plan for 28 annual conferences of the United Methodist Church called Health Flex. And included within those covered by the Health Flex plan, The majority are United Methodist clergy. However, it does also include some spouses who are covered by Health Flex, and also a significantly smaller number of lay employees. So several of the statistics that I'll be showing includes those other groups as well, but again, they are in the minority. One of the things that we have found in comparing our results from the Health Quotient, which is an online health risk assessment that all Health Flex participants are strongly encouraged to take each year, we find similar health risks as those shown in the annual Clergy Health Survey that Ann just shared with you. One of the things that we have found is a very high prevalence of a condition called metabolic syndrome. Now, what is that? It is a combination of risk factors that very often occur together. And whenever metabolic syndrome is present, there is an exponential risk in diabetes, stroke, heart disease. The American Heart Association defines metabolic syndrome as having 3 of 5 risk factors, any 3 of these 5, or taking medication for them. That includes high blood pressure, a high fasting glucose, a low HDL cholesterol, that's the good cholesterol, a high triglyceride level, or a high waist circumference. Any 3 of those qualifies you as having metabolic syndrome. Our population in the Health Flex plan population, almost 28% have metabolic syndrome and are at that increased risk of diabetes, stroke, and heart disease. Another tool that we use is called the Blueprint for Wellness, which is an objective biometric screening done by Quest Diagnostics. About 50% of our population participates in this. It's a combination of lab work, measuring blood pressure, weight, and waist circumference. Now, one of the frightening statistics is that 22% of this population that is under the age of 35 already has metabolic syndrome. 22% under the age of 35. The incidence of metabolic syndrome, as one would expect, tends to rise with age, and so the fact that they are this young and already at such high risk is really concerning. Now, part of the good news that we found, fortunately, is that it appears that the numerous wellness programs that we have instituted and encourage our participants to take part in seem to be having some impact. Something is having some positive impact. Because looking at a group from 2011 that met the criteria for metabolic syndrome, 57% of those then 2 years later, in 2013, had improved to the point that they no longer qualified as having metabolic syndrome. That's great. And that compares to 11% who did not have it in 2011 and got worse 2 years later to where they did qualify for it. So we need to really pay attention to those who are coming in, to those entering the process who are already at this significant high health risk. So what are some of the top costly conditions for the church? In presenting this, I'm presenting largely from the perspective of the interests of the church. And consistent with what Ann just said about the high incidence of depression, we see that depression is right there at the top of the list. The total estimated annual excess healthcare spending associated with depression is over $2 million. And then right underneath that is stress, which is approaching $4.5 million. We also have high blood sugar, over 800,000, obesity-related excess health care costs, over $1.5 million a year. So you can see that these are very costly conditions for the denomination. Then if we look at disability claims, this is for those who are on long-term disability, and what are the key diagnosis groups under which their disability qualifies. We see that over here under mental, that is 25% of our disabled population. And that is much, much higher than a comparable business area that Unum used to compare this with. And if you wonder what falls into mental versus nervous system, for example, nervous system is things like multiple sclerosis, Alzheimer's disease, quadriplegia, conditions such as that. Mental includes depression, bipolar illness, schizophrenia, that group of diagnoses. So again, we see the high cost of these health conditions to the church. But beyond the direct medical or disability costs, there's also other costs. You may or may not have heard of the term presenteeism. What in the world is that? It means that that person is present and still working on the job, but yet their health conditions are preventing them from being fully functional. So presenteeism results in a significant productivity loss, and more businesses and institutions are recognizing this more as a significant cost in the workplace as well. So how was this analysis done? Again, this was based on the health quotient, the online health risk assessment. It's a very well-validated instrument. The work limitations questionnaire, it's 8 items. It's self-reported, meaning that the person self-reports, well, I estimate that this percent of my work performance was affected by emotional or health conditions. Now, if there's a bias present, one would expect that the participant might tend to minimize the impact of health or emotional conditions on their work. The summary showed that annually, the financial impact from lost productivity is over $4 million. And this is in addition to those direct medical costs and disability costs. So what are some of the top productivity loss factors for clergy? And this is just based on United Methodist clergy. Poor emotional health is the number one. Again, we're seeing that again. Poor safety, that's things like not wearing your seatbelt, using prescription or non-prescription drugs for monitoring your mood, not using proper lifting technique, but then also drug use. It's not a high percentage of our participants who fit in this category, but for those who do, it's a significant impact. Again, we see high stress again, and then tobacco use. We have a very small percentage of our population that uses tobacco in any form, but as one might expect, for those who do, there is a significant impact. Job satisfaction. Of course, one would expect this to have a significant impact on one's productivity. The great news is that 95% of United Methodist clergy covered by the HealthFlex plan report either agreeing or strongly agreeing that they are satisfied with their job. That is great news. However, for those who are not, who answer either neutral, disagree, or strongly disagree, productivity plummets. So one might use this as a proxy, if you will, for burnout, which we know is also a risk in the clergy profession. What's something that helps? Exercise. We found that for those clergy who exercise 4 or more days a week for 30 minutes at a time, that they report significantly less productivity loss than those who don't. Kind of makes sense. It doesn't necessarily mean that if you don't exercise on a regular basis that you're not productive, but there is an association here. Okay, Ann, I'm going to turn it back over to you.
Thank you. We get our exercise by getting up and getting down. So you've heard already so far from a number of different perspectives that the clergy are not healthy. I want to switch a little bit from some of the pure data to more of the systemic perspective. Not sure many of you probably are familiar with, from public health, the socio-ecological model, which to me translates none of us operate in a vacuum. We influenced by the environment around us. For the UMC clergy person, if they're in local church parish ministry versus perhaps an extension ministry, the local church has a role, the district, their district superintendent, the conference, annual conference, there's conference policies, and then there is, of course, the world around us. Oops, sorry. Oh. Back in the last quadrennium, the UMC operates according to General Conference in quadrennium. So in 2007, the denomination formed, it was charged from General Conference to form a church systems task force. So the good news is the denomination asked a group to study what are the church systems and culture that negatively impact clergy health. So maybe they saw the previous diagram, they realized there's some systemic aspects, the culture, the areas in which we operate are going to influence clergy health. And in fact, it was a joint task force with our agency, Board of Pension and Health Benefits, and the Board of Higher Education and Ministry. So again, there was some acknowledgement of the role of health and systems for the clergy person. What the task force did as part of our research, and I was part of the team that helped to conduct some of this work, was to identify the clergy factors that matter to the clergy person. So we'll talk about that right now. And this, there's a handout that was posted under resources. I'm looking for the visual here. This will give you the definitions of these factors. But through online survey and then confirmation with follow-up calls to clergy, The task force identified 13 factors that differentiate healthy clergy from those who are unhealthy. And it's important to understand what that is. That is not to say that the task force went and identified a healthy profile so that the kind of perfect clergy person is going to descriptively look like this. What it said about was distinguishing clergy who are healthy from those who are unhealthy by those clergy who can best navigate throughout his or her career across these 13 factors. And thinking back to the socio-ecological model, as we look at some of these factors, we know some of these are more of a personal, individual responsibility. Some of them are more of an organizational and institutional manner. And then there's some that maybe slide back and forth between them. The way the chart is set up, multiple dimensions of health, right? That's what the Center for Health is interested in. So you see that as the first column, and then the factors are across the top. The shading is where generally that factor has an influence on that dimension of health. One good news is if perhaps you want to look at rows, if I'm going to focus on my emotional health, well, here's all the different factors, if you will, the areas in which I presumably will be better to navigate throughout my clergy career. If I want to work on a particular factor and it intersects multiple dimensions of health, well, that's great. I'll be that much more healthy in a number of different perspectives. So, for example, we heard this morning information about the Association of Theological Schools. One of the factors, education and preparation for ministry. What the survey told us was, golly, it's not like I didn't get all the theology I could ever hope and need. What the clergy told us was, I didn't get training in church finances. I didn't get training enough in how to counsel the ill. I didn't get training enough in family dynamics. So these are the factors that really mirror the real scope and demands of responsibility of the clergy in a local church. So we can see any number of these factors are part of the system, which will, of course, impact clergy health. Hopefully, this weaving of different data and factors is coming together to really indicate that the picture of the clergy have to be skilled in a number of different areas. And I think one of the questioners this morning brought that up in saying there's knowledge, there's skills, but there's abilities and there's personality characteristics, and all of that is really what the clergy person needs. So I just talked about seminary training. Itineracy for the UMC, one of the factors is stressors of the appointment system, also relocation. Inadequate support systems, one of the factors that we identified is needing to have a social life and outside interests. Also, congregation and communities may have unreasonable expectations. One of the factors is congregational relationships. Some of the clergy said, well, I wasn't really trained in leadership styles because I may have a different style than the lay leaders at the congregation. Also, some of what clergy indicated is that, well, the clergy person that I'm following went about business in this way, and I have a different personality, and I conduct meetings, and I'm a leader in a different way. That posed stress. And then also in terms of clergy, the existential burdens of being a clergy person. They indicated that the parishioners expected them to shoulder all of the parishioners' emotional and social burdens. So it's an extremely demanding job, profession, vocation, and we see that with some of the occupational stress information we saw earlier. And there you have it. It's certainly a unique profession. Clergy are on call, 24/7 job. One of the factors, living authentically. Clergy have said, and we heard this morning as well, if I'm conservative, but I'm appointed, plopped down right into liberal church, that can be difficult. How do I navigate that? One of the clergy women that I've worked with in the past, African-American woman, she said, I knew when I got appointed at one church, there was no way I could wear my hair in braids. But then I got another appointment, and I could wear my hair any way I wanted it. That comes back to some of the cross-cultural competencies that we heard. And then a number of clergy serve multiple churches, but particularly with the UMC in terms of itineracy, our clergy will average 3 moves in 10 years. Forgetting about different work environments every time you move, just think about what that means. We talked about financial stress, emotional stress, social stress, et cetera. And then for clergy who move in the UMC, about 85% of them have to physically move their household. It's not just that their appointment changed. And of those moves, I think it's like 7 or 8%, that clergy person is living separately from his or her spouse or children. All of that is going to have an impact on the clergy person's health. This next slide was some investigative work, if you will, that I did on behalf of the Church Systems Task Force several years ago. And what we were curious was, how do clergy compare to other, what I'll label, helping, caring, teaching, healing professions? So hence, that's why we've selected in this comparison group clergy, teachers, social workers, physicians, nurses, and professors. Helping, healing, caring, teaching professions. And looked at some of the stressors. You all probably know this list far better than I. Again, I am not at all a psychologist. But one, it's interesting, go clergy. You got a lot of X's there. So across some of the other similar type vocations, if you will, they've got a lot of stressors. And as I looked at this chart, kind of interesting, they compared fairly well, if you will, to social workers. In some aspects to keep in mind of why this comparison may or may not be useful is, think about a teacher. A teacher doesn't select his or her students. Clergy person doesn't select his or her congregation. A clergy person doesn't select who their staff parish committee is. A teacher doesn't select who the principal is. So, and then of course, in all sides, you have parental interference. So it is instructive to understand the different ways in which clergy experience stress, different factors that will influence them throughout their vocational career. And then the 2 type of stress models, there's the demand control stress model and the effort reward stress. Clergy, as well as some of those other professions, experience it from both. But once again, how much control do you have over your sphere in terms of your daily work environment? And some of this is unique to the clergy, as we said, being on call 24/7. You may be working with youth, but maybe you're also working in an elderly ministry. You may have one committee because it's the finances, but then you're also working with the youth choir. So you have all of these demands, and how much autonomy do you have? All of these things can come into play in terms of examination of a clergy's occupational stress. I'm going to let Shelly bring it home for us.
I recognize that most of you in the room, I believe, work with United Methodist clergy, but we also have some here from other denominations as well. And just to review a little bit some of the distinctive things about the United Methodist Church that is different from many other denominations. First of all, the United Methodist Church is connectional. How is that lived out? Now, that is opposed to a congregational system where each individual church is much more autonomous, like in the Baptist denomination, for example. In the United Methodist Church, all church property is is owned by the annual conference. That local congregation does not own their own property. Also, there are shared financial commitments. One of the pluses of this is that United Methodist churches can all contribute to accomplish things in worldwide ministries, for example, that they would not be able to accomplish by themselves. But there are also other shared financial commitments, such as supporting the salaries for conference staff, bishops, superintendents, etc. And of course, one of the most distinctive things about the United Methodist Church is the itinerant system, the fact that as United Methodist clergy, we are appointed to our place of service by a bishop. That means that there is a limited ability to say, no, I really don't think that proposed appointment fits my gifts and graces the best, nor does it really fit well with where my children are in school or with my spouse's work, etc. In an appointive system, there are limitations. Yes, there is a consultation process that takes place, but how that is actually conducted and the degree of influence that has in a given bishop's decision-making can vary considerably from one bishop to another. There are pluses and minuses to the itinerant system and a call system. Now, a United Methodist Church does not officially have the authority to fire their pastor. However, they can certainly recommend to the superintendent that their pastor be moved, and they can make their pastor's life very miserable in the meantime. So they find ways around that if they really want to. In the itinerant system, there tends to be more opportunity overall, in general, for women, because more than once, I was appointed to a church where I was the first woman pastor that they had ever had, and they were like cats hanging on the ceiling. You know, what are we going to do with this? And then after they get to know you, you think, oh, well, maybe this can work. So that's one of the pluses, but there's also minuses as well. So both with the call system and the itinerant system, pluses and minuses both ways. In a call system, you're likely only going to pursue a call with those churches where the geographic location tends to work for you, where you think that's really going to be the best fit for you, etc. So pluses and minuses both ways. And again, with the itinerant system, although most bishops are trying to keep clergy at a particular appointment for a longer period of time, there are still frequent moves. So, to whom is a United Methodist pastor accountable? A number of people. You've got the bishop, you've got your district superintendent, and they have their agendas and their emphases. And then you have, if you're in a local church, the local church, that pastor, staff, parish relations committee, the members of that congregation, and their expectations and their hopes and their beliefs about how you should spend your time, effort, etc. And those expectations don't necessarily mesh. Often there is a conflict between those expectations. So how do you as a pastor negotiate and navigate that landscape between all these various expectations that are placed on you from different directions? Well, what are some of the historical self-care challenges for clergy? Being the 24/7 profession that it is, the lack of emphasis, the lack of time really for self-care. Clergy don't get 3-day weekends. They don't even get weekends. Very often you don't get 2 days off in a row. So that those work issues and such are pretty much always there with you, and it's difficult to really have that time to really disconnect. The super pastor complex, those who are trying to please everyone, and yet realistically we know that that's just not possible to do. So how do you balance that? Again, different demands from a number of different directions in your life. The congregation, the hierarchy above you, your own family, the need to take care of yourself as well. The local church environment is not always that supportive of clergy health and well-being. I ate at a lot of potluck dinners where some of the choices were pretty limited. So that takes a lot of self-discipline and finding ways to navigate that landscape as well, so that you're not offending someone whose food you aren't eating, but also trying to meet your own dietary needs in a healthy way. Whenever you relocate, restarting all of those routines. It can involve a number of different things. Finding a safe, convenient place to go out and walk, finding a new physician, somebody to do your hair, a dentist, places for the kids to connect. There's just a number of different things that have to be readjusted. I mean, how many of you have moved, say, within the last 5 years? Okay, a few of you, and you're probably mostly the clergy in the room, aren't you? Probably many of you. And remember, for those of you who haven't moved in the last 5 years, if you can remember back to a move, remember how stressful that was and all of the different things that had to be addressed. Ann mentioned earlier the importance of social support outside the congregation. Being able to be with some people where you're not in that pastor role, to step out of that role for a period of time where you can just be a regular person and share frustrations, share whatever's going on, and just not have to be in that pastor role for a while. Some clergy can do that pretty readily. Others, it's like they always want to be in that role. But I think there's some importance to having some flexibility and some balance there. So a few summary points from our presentation. Although the great majority of clergy are satisfied with their work, ministry is stressful, both for the clergy and for their family and for their spouses. A high number of clergy, unfortunately, experience depression and other emotional issues. Some may come in with a history or predisposition. Others may develop that with the stresses and such of ministry, or a combination of the two. Often the church environment is not that supportive of good health for clergy, so clergy really have to be proactive about taking steps on their own behalf. So some considerations for those who are considering coming into ministry. They need to have a realistic view of just how demanding it can be and the types of demands, and not just for themselves, but if they're married, on their spouse and their family as well. I feel like it's important for them to be people who are readily willing to access resources and supports that can help them, where they can process issues going on with themselves or in their congregation with someone who's safe and trustworthy to do that with. Someone who is able to set healthy boundaries regarding their work-life balance, regarding the multiple demands that are put upon them, and to do that in a way that is firm and yet graceful in the congregational setting that they're in. And that those can be difficult things to navigate in the congregation. Again, at the Center for Health, we focus on clergy health and well-being across these 5 different dimensions. Of course, there's biblical basis for all of them. And we also encourage you to visit our website where we have more research, more publications and information available for you there. We are in the process of a website revamping. So if there's a link or something that's not working, we're in the process of correcting that. Thank you.